Hello, everyone. I am Dr. Kimberly Couri. I'm a family practice board-certified physician and also board-certified in a type of restorative reproductive medicine called naprotechnology. And I've been in practice for over 30 years, and about the last 20 years, I've done a combination of RRM, that's, restorative reproductive medicine, and functional medicine, which seeks to find the underlying cause. They're a perfect match because they're both looking at underlying causes of health. And it's this combination that I think has just been fantastic for women. Now, what I'm going to talk about today, many of you in the audience know because some of you are practitioners. But this is geared for people who don't know, the people who don't understand what it is. So for those of you who know, bear with me. For those of you who don't, I hope this is helpful for you. RRM is a type of medicine that is scientific, holistic, and comprehensive. It works in harmony with the woman's cycle, and it empowers her to take charge of her health. And it does this by helping women identify biomarkers in their own body, and then record them in a standardized way, so that someone who's trained in RRM can look at those and make sense out of it. So they're tracking their cervical mucus, they're tracking their bleeding patterns, they're tracking sometimes their temperature, and they're recording it. And in this way, we've sort of divided the cycle into 3 phases: the pre-ovulatory phase, the ovulatory phase, and the post-ovulatory phase. And a woman is charting her cycles, learning what her mucus is, when it comes, because the mucus leads up to ovulation. And after ovulation, there is no mucus. So there's a clear delineation there of when ovulation occurs. And this is invaluable for figuring out what's going on with a woman's cycle. So someone who's trained in RRM can look at these charts where the woman has made these biomarker recordings. There's different ones. We don't have to go into all the different ones, but and they can look and they could say, okay, this chart looks like there's patches of mucus instead of a normal mucus cycle. Maybe this woman has PCOS. You could also look and see, well, the second half of the cycle after ovulation is shorter than it should be. So maybe this woman is low in progesterone, which puts her at risk for infertility, miscarriage, and PMS symptoms. You can also see brown spotting, which is common but not normal. And brown spotting can mean lots of things. It can mean a low-grade infection. It can mean an autoimmune disorder, and there's a whole section of medicine that we're just exploring about immunology and things that are going wrong at the implantation site because of a malfunctioning immune system. So brown bleeding can indicate other hormone imbalances as well. And so that's the way you get the pieces together to try and correct and restore. And when you're having a woman recording in real time, this is invaluable for assessing hormones because there's different hormones in the first part of the cycle, the middle of the cycle, and the end of the cycle. And we know in RRM what those hormone levels should be at each place in the cycle. And so when we send a woman in for a hormone evaluation, we are timing that to her cycle, and we can then get the most accurate picture of if those hormones are normal or not. And then, if they're not normal, we can also treat with hormones in a way that restores her physiology, in a way that makes her function like she's supposed to. In other words, if she's low in progesterone, well, then we can time and give her progesterone when the body makes progesterone, which is after ovulation. So we can start it in her chart after she's ovulated and give it to her when she's supposed to get it. And this makes her cycle more like it should be. And that's why we call it restorative reproductive medicine. Now, there's lots of things we look at. And for infertility, we can look at ovulation disorders by doing a series of ultrasounds during the fertile phase and seeing, is she making a big enough follicle? Is that follicle rupturing? And you can think of the follicle as the carrier for the egg. And if she's not making a big enough follicle, then we would do something at the beginning of the cycle to help her make a better follicle. If she's making a big enough follicle but she's not releasing it, we would do something in the middle of the cycle to help her release the follicle. So this is very scientific and very well timed to her cycle and restoring her her reproductive health to what it should be if she was not having the problems that she's having. Endometriosis is another area that we excel in because we have specialized training for our surgeons for endometriosis. Endometriosis is when the cells inside the lining of the uterus implant in other places in the pelvis. It could be on the fallopian tubes, it could be on the ovaries, it could be on ligaments, it could be in the bowel, it could be on the bladder. And this can cause extreme pain and debilitating pain, actually, for women, and symptoms of bowel and bladder issues. It's really important to be able to get it all and get it out in a way that doesn't cause more scarring or harming of her fertility. And so we have specialized training for our surgeons that do just that. They remove it all, they find it all, and they do not cause more scarring. And this is really important. And in my practice, when I have someone, it's always an insurance issue, can I send them to the surgeon that I want to send them to that I know is going to do the best job? Now, of course, we look at tubes and uterine anatomy and those things too, but we also really understand that fertility is a vital sign for women. And so if there's something going wrong with their reproductive system, then there's probably something else going wrong with their overall health. And so we look at that person as a woman as a holistic person. And polycystic ovarian syndrome is a perfect example of that. This is something that can cause abnormal bleeding, irregular cycles, hormone imbalances, infertility, miscarriage, but it can also cause diabetes, heart disease, stroke when you get older in life. It can cause high blood pressure. It can cause uterine cancer. So when we are working with someone with PCOS, that's the abbreviation for polycystic ovarian syndrome, we look at them as a holistic person. We help them make lifestyle changes. We help them lose weight. We help them get their sugars balanced. We look at their sleep because those women are at higher risk for sleep apnea. We help them manage stress. So it's a very comprehensive approach where we're looking at women's reproductive systems, but we're also looking at the entire woman because we know they're interrelated. So with this kind of approach, you can't get a better healthcare system for a woman than this holistic approach. And I want to just mention that there are other factors that influence fertility, environmental factors, like you're talking environmental toxins in our water, air, soil, our food additives, our pesticides, herbicides, insecticides, all of those play a role. Before an egg is released, it is exposed for 3 months to whatever that woman is exposed to. And so if she's exposed to a lot of toxins, that egg is going to be exposed to a lot of toxins. So helping her detoxify makes for a healthier woman and also a healthier baby. And so that's part of what we do in our clinic in this combination of functional medicine and RRM medicine. And I thought I would just end with some real examples of how we've helped women, because we've helped hundreds of women in our clinic. There was a 37-year-old female came in. She and her husband had been experiencing infertility for 8 years. They had done all sorts of other things. So we put her through our lifestyle program. We balanced her hormones. She was low on progesterone. We fixed her thyroid. She had endometriosis surgery, and she's due in 1 week after 8 years of infertility. Then we have another patient who's 36. She's had 8 miscarriages. Now, I want to say a word about miscarriages because I think it's very underappreciated in our medical culture and in our culture at large. Women who have miscarriages have real pain and suffering. That's a real loss, and especially if you've had that many. And I think we just have to remember as members of society and as members of the medical community that they're having real pain and real grief, and we have to acknowledge that and validate that for them. Now, this woman also had chronic fatigue, so we found a low-grade infection. We put her on some progesterone. She had endometriosis surgery. We treated her fatigue, and she has a beautiful baby girl now. Then there's another patient of ours that was 23. She came in not cycling at all. She was also not very healthy. She was very tired. She had a lot of gut issues. We put her through our program. We helped her get her cycles back. She cycled then for several years normally, and she just recently had her first baby, no problem. She didn't need any intervention because we restored her fertility when she was younger. And that's the beauty of this. We are restoring women back to where they should be. And so I just want to end by saying I know this is something we can all get behind. Everyone wants great health for women. This is great health for women, and I'm very privileged to be a part of this.